Maria is an in-network child therapist and faces a common predicament. Diagnosing a child with anxiety is relatively simple compared to the monumental task of developing an effective treatment plan. Anxiety in children has been steadily increasing for the past 20 years, and there are 4.4 million children affected in the U.S. alone. Despite this, face-to-face time with patients is decreasing, while pressures from insurance companies and parents to deliver rapid results are increasing. Teaching children the proper language on how to express their emotions takes a long time, and finding the appropriate treatment can take even longer. With the onset of COVID-19, these existing issues are exacerbated to an unprecedented level.
Anxiety disorders are the most common mental health issues among children, both in the U.S. and around the world, and without proper treatment can lead to other more serious issues down the road like depression, suicide, or substance abuse. This means many mental health professionals deal with client anxiety daily. Of course, there are many outside pressures from insurance companies, parents, teachers, etc. that complicate the therapeutic process. The reality is that the process of finding a therapeutic solution involves huge amounts of time and money. This creates a stressful environment for everyone, especially the child. Finally, there's the question of which technique to employ to treat them. How can we help mental health care professionals like Maria both discover the child's source of anxiety and devise the best treatment as quickly and efficiently as possible?
Our solution is Aceso. Aceso is a software platform which leverages a wearable to process physiological indicators in children 6 to 14. The processed data is aggregated in an intuitive web application that professionals with parental approval can access. With our platform, mental health professionals can formulate an accurate diagnosis and treatment plan well before the condition turns serious. Our work has been guided by survey data and conversations with 12 potential customers.
The greatest benefit Aceso's analytics provides is helping child mental health care professionals expedite the process of determining which treatment for anxiety will work best. This is done by monitoring a child's anxiety levels on a day-to-day basis. There are many different tools such as cognitive behavioral therapy, meditation, exercise, or medication that could potentially help a child, but choosing the one that works the most efficiently without daily monitoring takes time. Aceso's day-to-day monitoring can also help professionals determine what kind of anxiety a child is experiencing, such as social anxiety, separation anxiety, or panic disorder, by alerting responsible parties when spikes in anxiety occur. Additionally, Aceso's interface tailors the user experience to the appropriate audience. It's important that different healthcare professionals can derive value from our software. With that being said, a therapist has a different understanding of anxiety than a school nurse or pediatrician. So, access to more complex features will be based on the qualifications of the healthcare professional using the product. Through our customer discovery process, we found that security and privacy are top priorities for parents. Aceso observes HIPAA compliance at every stage. Our cloud host, Microsoft Azure, is trusted by health insurance companies such as Blue Cross Blue Shield and Humana.
Through our customer discovery process, we found that most parents would only entertain our product if a mental health professional recommended it to them. So our primary target market are child mental health care professionals, such as pediatricians, therapists, and psychologists, who choose to utilize our technology in their practice. Later on, we plan to target direct to consumers after market adoption rates have increased and the industry accepts the solution.
We place our global total addressable market at $2.5 trillion and our United States TAM at $48.7 billion. Segmenting by income level and anxiety as a precondition, our serviceable addressable market nears $4.1 billion for 2.4 million consumers. This places our obtainable market at about $250 million of revenue within the first couple of years. If we generalize to include all children in the US, our SOM becomes significantly larger. This is just the US market today. Our niche demand is growing every year, and we want to service the wider global market as soon as possible. If we can integrate with existing wearables, we can break into the ecosystem of 1.1 billion connected wearable devices even faster.
Our team is made up of computer engineers with a variety of backgrounds and interests, from hardware, software, and statistics to psychology and law. Dr. Laura Barg-Walco is a human factors engineer and serves as an advisor specializing in human experience. We wish to expand our team by adding psychologists who can help to identify the human aspect of this social issue. As a team, our mission is to advance personalized healthcare and mental health awareness.
At Aceso, our goal is to improve children's lives through technology. We're asking for $2 million to advance the product's features, extend the backend capabilities, and validate our product with the target market. We've developed a prototype that collects physiological data and performs rudimentary psychoanalytics, and we're well on our way to having a device that can be field tested. We will use the investment to conduct field tests, ship the resulting software, handle legal issues, and establish an aggressive marketing practice. Our children are dealing with unique stressors, anxieties, and experiences that we've never had to endure before. Their lives will be forever changed by COVID-19. We hear in the media day in and day out that children are our future, that we need to invest in them, their education and physical health, but that must also include their mental health. Aceso is our solution to do just that. Thank you.